All right. Okay, good. Let me go to my effects, green screen, this, Mona Lisa. Great. All right. What the hell? All right, I'm gonna give y'all some time to come on in the room. Hello, hello. How y'all doing? All right, so if you are inside this room, you are here for NCLEX Jeopardy, okay? NCLEX Jeopardy, our live fun review for anyone that's preparing to take the NCLEX. Whether you're a nursing student, no matter what semester, whether you're a new grad or a retaker, doesn't matter. Practice is perfect, and that's why we're here, okay? So if this is your first time here, please comment down below that it's your first time. I want to say hello. Thank you so much for spending your Thursday evenings with me. Okay, but if this is your first time at NCLEX Jeopardy, please let me know down below. Comment down below if this is your first time in NCLEX Jeopardy. If this is not your first time and you are a repeat offender, welcome back. Okay. All right, so we have our first timer right here. Are you still hungry? Hello. I am still hungry. Salute me. This is my first time. Easy cooking first time. Awesome. Well, welcome everyone, whether it's your first time or you've been here before. All right, so the basis behind what we're going to be doing is we're just going to do a live fun review game. We're going to answer NCLEX style practice questions in the style of Jeopardy. All right, so it's going to be like a fun little review game, but like I said, we're doing it Jeopardy style, game show style, and we're playing for points. Okay, so how it's going to work, just like you can see everything right here on my screen, these are our 5 categories. Okay, I'm going to pick questions, all right, from each category, and we have 5 questions per category, as you can see right here, all ranging from 100 points to 500 points. Our categories are pharmacology, pediatrics, mental health, fundamentals, and med-surg. Okay, so we have a new one every week and every Thursday, I should say. And since October, we've been doing it on TikTok Live right here instead of like Instagram Live. So I'm very excited to bring this to you guys right here on TikTok Live. Okay, so if you guys want to see the replay, all right, to this, all our replays are going to be on our YouTube channel for free, but there's nothing like coming to the live, okay? Any questions you may have, we answer it live. If it's something that I don't know, we're going to look it up together. We're going to leave here knowing something else today, learning something new, okay? All right, so when I choose a question, all right, let's say I choose pharmacology for 100, something like that. You're going to see the question, you can see the answer choices. All right, majority of our questions are going to be multiple choice, but there may be some select all that apply in the full version, which is only accessible if you get our exclusive app, which is the NurseSam app, and this game, NCLEX Jeopardy, as well as the Tease version. Those are both exclusive to the NurseSam app. So if you want to play the full 25 questions of NCLEX Jeopardy, the only way to do that is if you download the app. All right, free to download, free to play. All right, so how it's going to work is going to bring up the question. It's going to say answer choice, the question and the answer choice. It's going to be 1, 2, 3, or 4. Okay, how we're going to play is once you read the question and you feel like you have the answer, you're going to comment down below what the answer is going to be. But please remember that this is Jeopardy style, so you have to say what is before you answer. All right, so let's say that you think the answer is the third option. You would say, what is 3? Okay, makes sense? What is 3 is going to be what you would actually say or type in the comments. Little trick. All right, since we're playing for points, we're playing for speed. Okay, obviously on the actual NCLEX, when you do take it, it's not like a competitive type style. You're not going to see everyone else's answers. It's not going to be Jeopardy style, so you don't have to say what is. And it doesn't matter if you're first, second, or ninth. As long as you get the correct answer, you're good, you're golden. All right, but because we're playing for like some prizes, a competitive edge, we're just going to make it just a little bit more fun, add a little bit of razzle dazzle to it to make it like competitive and not so overwhelming when you're preparing to take the NCLEX. okay? Or really any nursing school exam, because this is a comprehensive review. All right, so if y'all have any questions as we go through it, just drop them down in the comments. And either if I see it first, I'll answer. If somebody else knows the answer to it, they'll go ahead and answer, okay? But without further ado, if you guys are ready to start our free and fun NCLEX review, this is for our RN students or LPN students, so all nursing students are definitely welcome. But if you guys are ready to start our review, please drop a thumbs up in the comments below. Thumbs up in the comments if you guys are ready to start our first question. All right? Thumbs up in the comments. Another thing, you do not have to wait for me to read the question in order for you to answer. Okay? All right, so we're having some thumbs up. That means you guys are ready. Don't forget to say what is if you want to play for points. Okay? The person with the highest amount of points at the end of our game is going to win a free digital ultimate nursing school bundle. Okay, that's our 400-page bestseller. Going over, we have notes in all of these sections right here. Okay, and you will win a free, like I said, the free digital version of our 400-page ultimate nursing school bundle. All right, that goes for like $97, but you're gonna win it for free as long as you guys answer correctly and you get all the points at the end. All right, if you don't want to play for points, then just answer. You don't have to say what is. All right. All right, so I'm going to bring up the first question. Remember, if you want to play for points, say what is, okay? What is before you answer. All right, and let's go ahead and start with our first question. Let's do adult health for 500. Adult health for 500 is our first question. All right, so what do I do? I'll play with you, just answer. Yeah, just answer the question, but you say what is, okay? We're playing for points. So first person to answer correctly and in the correct format is going to be the winner of those points. All right, whoever answers or gets the most points at the end of the game is going to win a free ultimate nursing school bundle. All right, now let's go ahead and get into our question. It says, a client has been diagnosed with pyelonephritis. The nurse interprets that which health problem has placed the client at risk for this disorder. 1, diabetes mellitus. 2, orthostatic hypotension. 3, coronary artery disease. Or 4, intravenous contrast medium or IV contrast medium. All right. What is our answer? Remember, if you want to play for points, just say what is. If you don't want to play for points, you're just trying to see if you still got it, which you do, girl. You do got it. Just say that whatever you think the answer is, okay? All right, so I am getting I'm getting a little bit of everything, but a lot of people are saying 1, which is the diabetes. A lot of people are saying 4, IV contrast medium. All right, so drum roll, please. Let's go ahead and get our correct answer. Now, even though we're playing Jeopardy style, I still want you to take away the test-taking strategies that are needed in order for you guys to pass NCLEX, either on your first try, in 75 questions, whatever. I want you to go ahead and be successful. So whenever you are practicing taking any type of NCLEX style question, NCLEX practice question, you want to work your way up to about an average, or spending an average of about a minute, no more than a minute and a half on those questions. Okay, the NCLEX is timed, so you don't want to practice taking NCLEX questions without practicing speed as well. All right. All right, so the answer to this one is, drumroll please. What is 1, diabetes mellitus? What is 1, diabetes mellitus? That is the answer. All right, let's go ahead and see. I'm going to scroll up on my screen and see who answered first, who said what is 1 or what is diabetes mellitus first on my screen. All right, let's see who got it first. And the person to answer correctly is, 1 second, wait for it. T-Sean 16. Congratulations, T-Sean 16. Awesome job. All right, so you are now on the scoreboard with 500 points. Great job. All right, guys. If you do not get this answer correct, do not beat yourselves up. All right, the best part about these practice questions is A, it's practice, okay? Because at the end of the day, it really does not matter what score you get during this practice question, this practice test. It's just for practice, all right? The best thing about practice questions is you get to see and read the rationale. So now you know why you got it right or wrong, all right? So that next time when you see something like this or you see this content topic area, you'll be able to actually understand it, all right? Or you just need to get something wrong once, honestly, before you really understand it and never get it wrong again. Okay, so let's go ahead and read a rationale and see what we can take away from this. All right, the answer is, what is 1 diabetes mellitus? It says pyelonephritis is most commonly caused by entry of bacteria, obstruction, or reflux. Risk factors associated with pyelonephritis include diabetes mellitus, hypertension or high blood pressure, chronic renal calculi, which is chronic kidney stones, chronic cystitis, which is a bladder infection, overuse of analgesics, structural abnormalities of the urinary tract, presence of urinary stones, and indwelling or frequent urinary catheterization. All right, those are our risk factors. Okay, let me see what you guys, let's see what you guys are saying. All right, so a lot of people saying, yeah, I learned this today. Yeah, well, it's, yep, what is 1 diabetes mellitus, okay? Whether you're preparing for the current NCLEX or the next gen NCLEX, which is on or after April 1st, 2023, this content, this style, the clinical judgment and the clinical thinking that still needs to be practiced and obtained. And the best way to get that is through either experience or practice questions. Okay, you need to know like how to think like how the NCLEX wants you to think. All right, best way to do that is practice. See what y'all are saying. It says cousin AK not an infection. All these nurses saying 4. Don't do that. Someone said I didn't love that question. It's not a given. Yep, I just answered you about NCLEX Next Gen. Remember, the NCLEX Next Gen, you're not learning new content. The content is going to be the same. Okay, this is still valid and true whether you're taking the NCLEX now or later. How they're going to be presenting the NCLEX is what's changing. Okay, you're getting lots of case studies, you're getting different types of question types, but the actual content is not changing. That's still going to be consistent with the current NCLEX and the next one. All right, it's all about the question style and how you're going to answer that question. That's what's changing. All right, just want to make sure you guys know that. All right, great. Let's go ahead and if there's someone being negative in the comments, you can quite literally find your way out of this live. Okay, I don't do nurse bullying. I don't do nursing student bullying. So if you want to be smart when you come to this live, I suggest you remove yourself before I do. Okay, great. Awesome. Next question. Let's go. All right, guys, next question. We're going to do fundamentals for 300. Fundamentals for 300. All right, it says the nurse is providing information to a client about a computed tomography or CT scan of the head. Which statement should the nurse include when reviewing preparation for the CT with the client? 1, you will need to stand up straight for the entire procedure. 2, all scans require the injection of dye before the procedure. 3, each set of head scans takes less than 5 minutes to perform. Or 4, you will need to remain on bed rest for 12 hours after the scan. All right. Which statement should the nurse include when reviewing preparation for the CT with the client? All right. Make sure you are breaking down the question so you really understand what it's asking you. Okay. That's why I always suggest when you're breaking down the question, look at what the question's asking, the problem, and the solution to that problem. That's how you really answer these NCLEX style questions. Okay. So when you're trying to ask yourself what the question's really asking you, just reread at least that last line of the question. Okay? So you can be reminded of what's really asking you. All right? So, let me see what y'all are saying. I'm seeing like lots of 3s and some 2s as well. 3s and 2s. All right, so let's go ahead and see what that answer is. Okay. And the answer is, drumroll please, fundamentals for 300. The answer is, what is 3? Each set of head scans take less than 5 minutes to perform. That is the answer. Less than 5 minutes to perform. It says the NCLEX time. Yes, the NCLEX is timed. Oh, wait. No, move that one. All right, so who got what is 3 first? And I'm going to read the rationale so we understand what is being asked. All right, so T-Shawn got it again. All right, T-Shawn, you're already in the scoreboard with 500 points, and you just got this one. You're the first person to say what is 3 on my scoreboard. So 500 plus 300, you now have 800 points. All right, snaps to you. Great job to everyone else that got what is 3. All right, so if you do not get what is 3, it is okay. That's why we have the rationale right here. And let's go ahead and go over it. All right, it says for a CT scan of the head, the client lies on a movable table in a head holding device. Each set of head scans takes less than 5 minutes to perform. An iodinated, there you go, contrast medium, iodine, okay, may or may not be used. Okay, so I saw you guys kind of battling that out, but in the comments. It may or may not be used. That's why they have a CT scan or whatever scan with or without contrast. It says no special aftercare is indicated. So the client may resume the usual diet and activity afterwards. All right, so the answer is what is 3. All right. Great job to everyone that got what is 3. Now let me see what y'all are saying in the comments. I'm only in week 11 of my ABSM, but I'm going to play anyway. Listen, this is a great review because we're going all the way from fundamentals, hitting everything else that you're going to learn up until you take your NCLEX. Okay? So it doesn't matter what semester you're in. This is a great review for anybody that's in nursing school. It doesn't matter if you're preparing for the NCLEX or if you're preparing for your like chapter 2 of your fundamentals. You're always going to learn something that's going to be useful in nursing school. Okay? And it's free and fun. All right? Next question. Y'all ready? Okay. I was just looking at your comments, making sure everyone got this one. Okay. Honey, we didn't say anything about getting money. All right. Once again, for anyone that is just coming in, I'm going to get the next question up. All right. This is NCLEX Jeopardy, a free and fun review. Next question is going to be mental health for 100. All right. So while y'all are reading that really quick, the person that has the highest amount of points at the end of this game is going to win a free digital nursing school bundle. What happened to my thing? Hold on. Wait for it. There we go. Sorry. I don't know what happened to it. All right. So the winner is going to win a free digital ultimate nursing school bundle. So whoever wins is going to send me their name and email address so I can send that prize to them. Okay. Ain't no money. Ain't no money. But you are winning a product that is worth $97. So technically you're winning something. All right. So mental health for 100. Once again, make sure you say what is if you want the points. It says a client who has shared with the group at a previous session now suddenly gets up and announces, "I'm leaving." How can the nurse initially meet the needs of both the client and the group? 1, offer to go with the client to his room to talk. 2, ask the client to refocus the group's discussion. 3, end the therapy session for everyone immediately. Or 4, ask the client to stay and share what he or she is feeling. All right. No, you cannot. No, you cannot. You're winning a free digital ultimate nursing school bundle. That is what you're winning. All right. What is our answer? How can the nurse initially meet the needs of both the client and the group? Okay. Whether you know this or not, I'm just going to tell you guys this little test taking strategy when it comes to nursing school / NCLEX questions. Whenever you see priority words such as initially, first, priority, any of those words, it means something. Okay, so when you see words that are almost like tied to a time or time frame, pay attention. Initially means first, which is a priority, which means you're going to be looking at and thinking about priority interventions. Okay, so let me get to our answer. Our answer for this question, remember this is mental health. All right, so you want to think a lot about therapeutic communication, especially towards your specific client. The answer to this question is, what is 4? Ask the client to stay and share what he is feeling. Okay. The answer to this question is, what is 4? Okay. I'm looking at what y'all are saying. Remember to say what is. First person to say what is for this specific question is Killange Bell. Killange Bell. Congratulations. You are on the scoreboard with 100 points. All right. That's first person to say what is 4. All right. Let me look and see what y'all are saying. Okay, a lot of people said what is 4, so great job. I got that right immediately. Awesome job. So you got that right immediately. All right. All right, so for everyone that did not get 4, let's look and see why the answer was 4. It says if a client attempts to leave a group session, ask the client what he is feeling and try to connect that behavior with a feeling. None of the other options encourages the sharing of the client's feelings. All right. That is the method of therapeutic communication. All right. You want to encourage the sharing of feelings, the client's feelings, so you get an understanding of what they're feeling, so you can try to solve it if you can. Sometimes people just want to talk, but that's not what the question was asking you. But it's very important that you know why the answer is what it is. Okay? All right, next question, unless you guys need more clarity on this one. All right, here we go. Thank you so much. All right, next one. All right, next topic is, wait, did I give points? Yes, I did. Boom. All right, pediatrics for 400. That's our next one. I do have YouTube, and all of these replays are going to be on my YouTube. Okay? If you click the link in my bio, it'll show you what my link is, or you can go to thenursesamtv.com, and it'll send you to my YouTube link. All right, pediatrics for 400. It says the mother of an 8-year-old child being treated for right lower lobe pneumonia at home calls the clinic nurse. The mother tells the nurse that the child complains of discomfort on the right side and that ibuprofen is not effective. Which instruction should the nurse provide to the mother? 1. Increase the dose of ibuprofen. 2. Increase the frequency of ibuprofen. 3. Encourage the child to lie on the left side. Or 4, encourage the child to lie on the right side. Which instruction should the nurse provide to the mother? All right, this is pediatrics for 400. want to see. After you say your answer, remember this is Jeopardy. This is NCLEX Jeopardy. So you have to say what is if you want the points. Okay? If you don't want the points, you just want to just see what you remember, see what you know. Just say 1, 2, 3, or 4. Okay? But I am interested in hearing why you guys are getting the answers that you're getting. All right? It's very important to know why you are choosing the answer that you're choosing. All right? So it could be appendicitis. I'm getting lots of what is 3, which is encourage the child to lie on the left side. Why? Someone said to help expand the right lung. Someone said decrease the pressure on the right side. Serena said you want to put the bad side up, so you want to lie on what? The unaffected side? All right, let's look and see. It says, so somebody said, we're not doctors, we can't prescribe. Very important, we sure cannot. All right. 3, treat physical needs to alleviate pain. You don't want to increase medication unless absolutely necessary. We're nursing, we don't decide dose and frequency. All right, let's look and see what that answer is. All right. First of all, it says, let's go back and look at that question. It says, the mother of an 8-year-old child being treated for right lower lobe pneumonia at home calls the clinic nurse. All right. Y'all know what pneumonia is? Do you guys know what right lower lobe pneumonia is? What that entails with those, especially in a pediatric patient? Just wanted to ask. All right. The mother tells the nurse that the child complains of discomfort on the right side and that ibuprofen is not effective. All right. The question says, which instruction should the nurse, which is us, me, you, we, okay, provide to the mother? Let's look and see what that answer is. All right. So pediatrics for 400. The answer is what is 4? Encourage the child to lie on the right side. On the right side. On the right side. Were you surprised? Were you surprised that the answer was 4? All right, hold on. Let me scroll up to see who got what is 4 first. There's a lot of people that said what is 3, but we're going to sit here and see why the answer is what is 4. All right. It's Rochelle got that one. Hey, it's Rochelle. Do you want your points? It's Rochelle got that one. If Rochelle does not want her points, Bondu Pamland is going to be the next person to get it. I'm going to write it down just in case. She usually doesn't want her points because she won already, but I don't remember if that's this or the other Jeopardy. All right, so one of y'all can get it. All right, let's go down and see what y'all are saying. All right, so it's Rochelle she doesn't want the points, she just wants to she's here for the review. She wants to give it to the next person, which is Bondu. My name is Esther. All right, Esther, you get the points, so you are now on the scoreboard with 400 points. Awesome job. All right, let's look and see why the answer is encourage the child to lie on the right side. Okay, so remember I said, do we know what pneumonia is? Pneumonia is an inflammation of the pulmonary parenchyma, or parenchyma, I don't know how to pronounce that, or alveoli, or both, caused by a virus, mycoplasma agents, bacteria, or aspiration of foreign substances. I know what aspiration means, when you like pretty much breathe in something that's not supposed to go there, or you like swallow foreign material. You aspirate into your lung. All right. It says splinting of the affected side. Remember, we have right lower lobe pneumonia. All right. So our pneumonia is over here. Okay. Splinting of the affected side by lying on that side may decrease discomfort. Okay. It would be inappropriate to advise the mother to increase the dose or frequency of the ibuprofen. I'm so glad so many of you guys caught that. It is not within our scope of practice, whether you are an RN or an LPN, okay? It's not within either of our scope of practice to tell somebody what to do with medications that we do not have a clear order in front of to follow. Okay, we can't just go all willy-nilly, just be like, oh, do this. It's not our place. It's not within our scope of practice. All right, so it would be inappropriate, once again, to advise that mother to increase the dose or frequency of the ibuprofen. That's why it's always usually, please consult with your physician. Please refer to your provider for that. That is such a quick, my name is Bennett. I'm not in it, not my license, Jesus. Please consult with your physician. I'm so sorry. So that would be more appropriate than tell them what to do with the prescription, with the medication. Then it says lying on the left side would not be helpful in alleviating discomfort. Okay. A lot of people are saying to lie on the other side to expand the lung, but breathing difficulty wasn't what the question asked. It was specific to discomfort, not, oh, I can't breathe. All right. So splinting is usually what helps discomfort, especially when it comes to internal organs, especially over here. We do the same thing when they have like abdominal surgery. So splinting when you're laughing or doing something like that, that's going to actually help with that pressure. Well, the pressure is really what causes that discomfort. I'll say that. So splinting is what's going to remedy that. Okay. Especially initially. Okay. Then let's see what the answer is. I always read into questions, my big issue. I know, that's why we go over it as a group, because it can be anyone's mistake to just kind of read something or too fast or too slow or just miss something altogether. All right, guys, let's go ahead. Y'all got that? All right, let's go to the next question. That was P's for 400. Let's do our next question, which is pharmacology for 300. Tricky question. Yes and no. Yes and no. What that basically does is it just makes sure that you are clinically thinking as a nurse. Sometimes you have to see things steps ahead. And that's basically what the NCLEX wants you to do. That's that clinical judgment they're trying to make sure you have. All right. This is awesome. How to do this. Thank you so much. I do this every week, every Thursday, right here at 7 p.m. All right, guys. Next question. Pharmacology for 300. All right. It says a client with diabetes mellitus taking daily NPH insulin has been started on therapy with dexamethasone. The nurse anticipates that which adjustments in medication dosage will be made. 1, an increased dose of NPH insulin. 2, a change to oral diabetic medication. 3, a lower dose of dexamethasone than usual. Or 4, an increase in the amount of daily dietary calories. Says the nurse anticipates that which adjustments in medication dosage will be made. All right. That's what the question's asking. What's that medication? All right. Remember, we have a client with diabetes taking daily NPH insulin, and they were just started on dexamethasone. All right. So there has to be some kind of link between diabetics, NPH insulin, and those that are starting therapy with dexamethasone. So number one thing, what kind of medication is dexamethasone? Ooh, you see how we have to, it's like we're Scooby-Doo, okay? We have to put the clues together in order to get to our answer. All right. What is our answer? What is our answer? I said it's a steroid. Thank you. All right. So somebody already said dexamethasone is a steroid. So if you have not answered, let that help you. All right. So we have a client with diabetes taking insulin, and they just started on steroids. What do y'all know about steroids and its effects on clients with diabetes. Maybe clients without diabetes. What do you like? It's just this will be a good one because this is definitely you're definitely going to be assessed on this, whether it's on the NCLEX or your chapter whatever exam for pharmacology or endocrine, whatever. It's definitely going to do that. Y'all already answering and telling me, ooh, I just love it. Steroids increase blood sugar. So if we have a client that's already a diabetic and they're taking daily daily insulin, all right. If we have somebody that already has high blood sugar, and then you add a steroid to it, what do you think is going to happen to the person that already has high blood sugars? They're going to be higher, right? They're going to look at their log and be like, you know what? I have noticed since starting this dexamethasone that my blood sugars have been higher. It has spiked my blood sugars higher than usual, higher than they normally are, right? Right? Okay, great. So if you know that, and you know that they take that daily NPH insulin. Remember, as nurses, we can't tell them what to do. That's why the question says the nurse anticipates that the doctor, the provider, whoever is going to make some adjustments with the medication dosage. What do you expect those adjustments to be? That's how you have to think about everything all into one in order to answer this question. Y'all feel me? All right, let's see what y'all saying. All right, so let's look and see what the actual answer is. Now that y'all maybe are picking up what I'm putting down, let's see if y'all get what I'm saying. All right, and the answer is, y'all ready for the answer? All right, let's go ahead. The answer is, what is one? An increased dose of NPH insulin. An increased dose of that insulin. All right, that is the answer. Great job to everyone that said one. I'm scrolling back up to see what y'all are saying. Looking to see. Don't say, is this steroid an inducer, inhibitor? An inducer or inhibitor of what? Taste Kaylin. Honestly, that answer, and with this specific question, that is irrelevant to the answer. It's a steroid, and steroids have a certain effect on blood sugar, and that's to increase them. So that's gonna be what the effect is, whether it's an inducer or inhibitor. I don't even know what that means, to be honest. All right, so let's see who's the first person to get what is one. All right, first person to get what is one is, hold on. Wait for it. Wait. A lot of people just said one without saying what is. But a lot of people didn't want it. First person I see is Heather M518. Heather M518. You're the first person to say what is one. But everybody else said one. Y'all just didn't say what is. So remember, like I said, if you did not say what is, I'm assuming you don't want the points. And you just want the review. So Heather M. My pen. M518 got those points. You are now on the scoreboard with 300 points. All right. So this says dexamethasone. What? Dexamethasone is a glucocorticoid, aka corticosteroid. So a steroid, right? Exactly. And therefore, it can elevate the blood glucose level. Okay. Diabetic clients may need their dosage of insulin or oral hypoglycemic medication increase during glucocorticoid therapy. All right, this is most often a temporary change. It's usually just needed to compensate for the actions of the medication. So while they are on steroids, that time that they're on steroids is usually when the nurse can expect for that medication to be adjusted. Not by us, but adjusted by that client's physician. Once they see that they're already a diabetic and they're taking steroid therapy, that's what the nurse can expect. Okay, it says the client would not change to an oral diabetic medication if taking daily insulin. All right, additional calories would not be required either. The client would not take a lower dose of dexamethasone than usual to compensate. That just didn't apply. So the answer, once again, is what is 1. But how y'all got to what is 1 was the really important thing that I wanted to make sure that you guys understood. Okay. So is this ends at, yes, it ends at 8, unfortunately. It ends at 8. I'm finished for I'm a med tech getting ready for my LPN classes next year. Anyways, right. Honestly, it's so fun. My husband is not a nurse. He's not in healthcare at all. He's like business, real estate. That's him. But every time I do NCLEX Jeopardy, like he was supposed to be gone, but he's right out here listening to NCLEX Jeopardy. Like I hear him. He loves it too. Like it's just fun to see what you know. It's super fun. Hold on. We start at 7 p.m. Every Thursday. Okay. All right. Next question. Oh, good luck to all you guys that are graduating or about to graduate. Let's do our next question. I think this next question is our last question. I actually posted this question earlier, and I said we would go over it in live, so that's exactly what we're gonna do. So hold on, let me find it. Wait, hold on, wait. Okay, it's actually a Pete's question. All right, this is our last question, guys. Did I give points? I did. It was Heather. Yay! My friend said the gummies are good. They are so good. I had to take a screenshot of that. That made me feel nice. Yay! Hold on. It went away. My fault. Oh, it's because I took a thing. My fault. All right, let me put it back up. Okay, sorry about that. Wasn't me. All right, guys, let's see what that answer is. Pediatric, well, I'm gonna let y'all see the question, obviously. This is pediatrics for 100. I'm just scrolling back. Good luck to you all. All right. It says, the nurse is caring for a newborn with a suspected diagnosis of an imperforate anus. The nurse monitors the infant, knowing that which is a clinical manifestation associated with this disorder. 1, bile-stained fecal emesis. 2, the passage of current jelly-like stools. 3, failure to pass meconium stool in the first 24 hours after birth. Or 4, sausage-shaped mass palpated in the upper right abdominal quadrant. If you do not take peds yet, that's fine. You're going to be happy that you are here for this answer because you're going to need to know this. You will eventually, whenever you take peds, you will definitely see this again. So just go ahead and just put your best foot forward and just try. We're going to go over it anyway. Okay? All right, so what do you guys think this answer is? I'm getting lots of 3s, which is the failure to pass meconium stool in the first 24 hours after birth. I'm looking to see who got this first. Wait for it. All right. I know they're not going. All right, you guys ready for the answer? Are y'all ready for the answer? I'm gonna scroll down. A lot of people saying 3 or 4. Ooh, what is it? All right, let's go through it. Hold on, let me get it. All right, and the answer to this question is, what is 3? Failure to pass meconium stool in the first 24 hours after birth. All right. The answer is, what is 3? First person to get this really it's Rochelle, but she's going to donate her points. And so if she donates her points to the next person, it is Styled by Cass. Congratulations, Styled by Cass. You're on the scoreboard with 100 points. Ooh, sorry. All right, so it says an imperforate anus is the incomplete development of or absence of the anus in its normal position in the perineum. Okay. During the newborn assessment, this defect should be identified easily on site. However, a rectal thermometer or tube may be necessary to determine patency. When you see the word patency, it means like ability to be open. Okay. How open it is. It determines patency if meconium is not passed in the first 24 hours after birth. Other assessment findings include absence or stenosis of the anal rectal canal, presence of an anal membrane, and an external fistula to the perineum. Okay. Options 1, 2, and 4, those were all notings of intussusception. Okay. And you just dropped a very important note. All right. She said that it's very important to assess it in the first hour of birth. All right. Because the baby cannot be breastfed if imperforate anus is, they have signs and symptoms or clinical manifestations of an imperforate anus. All right. So that is definitely done during the newborn assessment. That's something that's assessed within that first hour. Okay. I wish I could do this at good on NCLEX. It's Rochelle. You will do this good on NCLEX. Girl, you've been killing NCLEX Jeopardy for I don't know how long. These are NCLEX style questions. Okay, so people that come here and practice with me, I cannot tell you on a daily basis how many people specifically say, oh my gosh, thanks to your study guides and or NCLEX Jeopardy that you have with us every week. Like that really helped. Like I had so many questions that were from your NCLEX Jeopardy. All right, these are NCLEX style questions. They will be asked just like this. Okay, it may not be the exact same question, but the things that they are looking for and trying to prepare you for, the content, that's the same. Okay? I wouldn't be wasting my time doing this if it was just for fun for me. Okay? Not only is it fun for everybody, but it actually really works. Okay, that is definitely my goal. That is my goal of my whole business. I've been doing it for 2+ years. I really want you guys to pass NCLEX, become great nurses, and I want you guys to not to have this overwhelming anxiety attack ridden experience that is nursing school. I had that, and I don't want to pass that on. That's not cute for me. Like I don't like to pass on anxiety and stress to you guys. So if there's a way that I can make it more fun, more effective, and just a better overall experience for you guys, that is my goal. That's what I've been doing for almost 3 years, and that's what I'm going to continue doing. Okay? All right. A lot of people said they like this. But yes, guys, I do this every Thursday. We do it live for a few questions. And then if you guys want to play the full 25 questions on your own, you have to download the NurseSam app. That way you can play NCLEX Jeopardy just like this, at your own speed, at your own pace, anywhere, anytime. It's within the app, all right? It's free to download the app. The app is called the NurseSam. Free to download, free to play, okay? A lot of people are talking about gummies. Hold on, let me answer y'all question. Before I answer y'all question, the person with the most amount of points, all right, ended up being Tishawn 16. Tishawn 16, are you still here? Congratulations. You have won a free Ultimate Nursing School bundle. So, woo, congratulations. I hope you're still here. Tishawn, I don't know if you have Instagram or not, but if you do, I'm just going to need some information from you, like your name, first and last, and a good email address so I can go ahead and send that free digital 400-page PDF, aka our best-selling Ultimate Nursing School Bundle. Okay. Let me put my thing on. Like I said, if you guys want to play the rest of the questions, this is where you can go. Right there. All right, so T-Sean said, a lot of people are talking about the gummies. Hold on. Wait for it. Let me just talk about the gummies because a lot of people are talking about it. All right, so the gummies, they ship every Saturday. Our last shipment was actually, well, we did a surprise shipment or an extra shipment on, I think, like Tuesday. But the next shipment is going to be Saturday. All right, if you order it Saturday or order it before Saturday, it'll get to you probably about Tuesday or Wednesday. Okay, so we do ship them at least once a week, once every Saturday for sure. And get them from that Saturday. It takes about 2 to 3 business days to get to you, depending on where you are. We do ship to New York. We ship all over the U.S. So we ship all over the U.S. The study gummies is what everyone's talking about. Okay. Yeah, we're definitely going to sell out the gummies. Yeah, we're definitely going to sell out the gummies. We sell out all the time. Same time, same day, same app next week. Absolutely. I'm going to be enjoying, I'm going to be enjoying my birthday next week, but that's fine because we'll still be here. So if we're doing Nurse Sam and y'all see me and I'm in a bathing suit poolside sipping a margarita, but we still doing NCLEX Jeopardy, just know that I'm celebrating my birthday because I definitely am. I will be next week, but I'm still making sure y'all got y'all practice. All right. So same time, same app, same day next week. Next week, Thursday at 7 p.m. right here on TikTok Live. I will have the week for you. At the link for you guys. So if y'all want to sign up for it, it, like I said, it's free. It's just for the reminder, so y'all get a reminder. Okay, that'll be next week. If you guys missed this and you want to rewatch this replay, this will be up on our our YouTube, which is the Nurse Sam TV. All right, the Nurse Sam TV. If you subscribe there, you have like over 100 different videos that you guys can just kind of watch of NCLEX Jeopardy, older episodes, and like reviews such as like maternity review or test taking strategies. Other videos are up there as well. Okay. Right, Beware Fakes. She's the original. Thank y'all so much. Y'all are so sweet. Is there a discount code for the gummies? If you spin, I think it's still a pumpkin, but if you spin the wheel of discounts right now, I think it's a pumpkin. But if you go to the site and you spin like that floating pumpkin, you can get up to 35% off of that. But if y'all have the discount code, if y'all have the downloaded app, which is the Nurse Sam app, I'll send out a special code for you guys, a special thank you to everyone that downloaded the app. That way you can use it on gummies, study guides, or whatever. So that'll be just for you guys that download the app, okay? But you better download it because I'm about to send it at 9 p.m. That's when I'm going to send it. Maybe 8:30. No, I'm going to send it at 9. All right. Thank y'all so much for joining me. And I will see y'all next week, okay? Thank you.